Iron Deficiency Anemia. Iron deficiency anemia is the most common form of anemia worldwide. Iron is a vital component of the heme synthesis pathway, binding to protoporphyrin to form hemoglobin. When iron supply is insufficient, red blood cell production is impaired, resulting in a microcytic hypochromic anemia. Peak incidence. High-risk groups include preschool children, women of reproductive age due to menstrual blood loss, elderly individuals often secondary to occult gastrointestinal bleeding, and individuals with restricted diets, for example vegetarian or vegan diets lacking iron-rich foods. Pathophysiology. Iron is required for hemoglobin synthesis. Deficiency occurs when iron intake, absorption, or storage does not meet the body's demands. The bone marrow produces smaller, microcytic, paler, hypochromic red blood cells. Causes can be grouped as blood loss. Menorrhagia is the most common cause in premenopausal women. Gastrointestinal bleeding, for example peptic ulcer, gastritis, colorectal cancer, polyps, and inflammatory bowel disease. Inadequate intake/absorption. Poor dietary intake, and malabsorption, for example in celiac disease, post-gastrectomy, Helicobacter pylori infection, long-term proton pump inhibitor use. And increased demand, for example in pregnancy, and rapid growth, for example adolescence. Symptoms: fatigue, shortness of breath on exertion, palpitations, dizziness or lightheadedness, poor concentration and headaches, pica, an abnormal craving, for example ice, chalk and paper, and restless leg syndrome. Signs: conjunctival pallor, tachycardia, systolic flow murmur, koilonychia, spoon-shaped nails, angular cheilitis, atrophic glossitis, and hair loss. Diagnosis: history and examination, dietary history, medications, bowel habit changes, weight loss, and menstrual history. Investigations: full blood count, low hemoglobin, low mean corpuscular volume (MCV), low mean corpuscular hemoglobin (MCH), and a high red cell distribution width (RDW). Iron studies. This confirms low serum iron and low serum ferritin, which is the most specific indicator but can be raised in inflammation as it is an acute phase reactant. High total iron binding capacity (TIBC), and a low transferrin saturation. Blood film, anisopoikilocytosis, pen cells, and target cells. Further investigations, depending on the context: celiac screen, stool fit test, upper and or lower gastrointestinal endoscopy, and pelvic ultrasound if gynecological cause is suspected. Complications: worsening of pre-existing cardiac disease, for example heart failure and angina. Immune compromise leading to increased susceptibility to infections. Missed underlying pathology, for example colorectal carcinoma, if iron deficiency anemia is not properly investigated. Management: identify and treat the underlying cause. Refer under the 2-week wait pathway if malignancy is suspected, especially in adult men and postmenopausal women. Iron replacement therapy. Oral ferrous sulfate is first line. Continue treatments for 3 to 6 months after HB normalizes to replenish iron stores. Encourage dietary iron intake through leafy vegetables, red meat, and legumes. Parenteral iron infusion indications: oral iron not tolerated or ineffective, severe deficiency with ongoing blood loss, late pregnancy requiring rapid HB correction, and post-operative need or malabsorption, for example inflammatory bowel disease and bariatric surgery. Blood transfusion. This is reserved for patients who are hemodynamically unstable or symptomatic with very low HB. Typical thresholds. HB less than 70 grams per litre in an otherwise healthy adult. HB less than 80 grams per litre in patients with cardiovascular disease. It is always guided by clinical symptoms rather than HB value alone. Prognosis. Excellent with appropriate treatment and removal of the underlying cause. Recurrence is likely if the bleeding source is not identified or treated. Chronic cases can impact quality of life and worsen comorbidities, for example heart failure. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today